As the number of positive COVID cases continues to climb in our state, I've been analyzing state data to find out who's dying during this pandemic and why the true death toll is likely higher than what the state is reporting. As Florida makes national headlines for becoming the world's new epicenter of COVID-19, reaching its own record highs for deaths and hospitalizations, data we've analyzed suggests the pandemic's most extreme impacts on the Sunshine State may be deadlier than what state leaders have told the public.
We're undercounting the COVID-19 related deaths.
Dr. Tom Tsai is a surgeon and health policy researcher at Harvard University. He says the true cost of the pandemic can best be described by something called excess mortality.
And across states in the United States and on a national level, we're seeing an uptick or an increased number of deaths than otherwise would have been expected or predicted during this time period.
Let me explain. This is the average number of deaths in Florida during the month of April over the past 5 years. You can see each April about 17,000 people die in our state. But this past April, that number spiked to more than 19,000, which means there were more than 2,000 deaths above and beyond what was expected under normal conditions. This is what the health world calls excess mortality.
It gives us a sense of the true magnitude of what the pandemic is.
The state only attributed COVID-19 to just over 1,000 deaths it reported in April. Dr. Tsai explains why some of the rest of those deaths could also be attributed to the pandemic.
Part of the excess mortality, excess deaths, may be due to patients or individuals with non-COVID conditions, things like heart attack or cancer or stroke, who were not able to receive care during the pandemic. They're both important in understanding the true cost of the pandemic.
A look at the past 6 months shows why health experts are concerned. From January to June, Florida reported more than 8,600 excess deaths, more than double what the state has attributed so far to COVID-19.
It's as close to a smoking gun as you'll get in statistics. It's really clear there's something going on.
Dr. Troy Quast is a health researcher at the University of South Florida. He says the increase in excess mortality data is a sign the state may be underplaying the virus and its true death toll on Florida.
It does lead you to think that there might be at least more investigation is warranted.
Dr. Tsai agrees and warns with the state's recent surge in cases, Florida's death rate will go up, while Florida's window to control it is quickly closing.
This is not the time for half measures. This is a time for focused action to truly flatten the curve on the pandemic in Florida. We don't want to see the pandemic show itself in the fatality numbers. That's too little, too late. We looked at the data as of yesterday, but that count is constantly changing because deaths in our state are constantly being certified, which means measuring the true death toll of this virus in our state could take years to fully understand. Katie LeGrone, WSFL TV.